Hi, good evening. I hope you're having a lovely day. I'm just going to wait for more people to join in. Hi, good evening, Dr. Deeksha.
Good evening.
All right.
How are you?
I'm fine. How are you?
I'm good.
All right. So thank you so much, Dr. Deeksha, for joining in and doing this live session with us. And good evening and welcome to all. So today's session is going to be on menstrual health and disorders. And Dr. Deeksha here is an OBGYN physiotherapist, and she's specialized in pelvic floor rehabilitation. So Dr. Deeksha, let's start with the questions, and if the audience has more questions, we will take them as and when they come.
Definitely. And thank you so much for inviting me.
The pleasure is all ours. So first things first, Dr. Deeksha, how did you become an OBGYN physiotherapist and also specialize in pelvic floor rehab? Like, what led you to it?
Actually, when I was in my bachelor, when I was in a library, I just got through a book on OB-GYN and a role of physiotherapy. So it was something which got my interest. So I was like, I have to do something. I have to explore more. I have to reach overseas to study this. So then I just go to outside and just study about the pelvic floor. And then the topic, the sex and women's health and physiotherapy, this excites me more. So from that day, I just got my motto of life: being woman, love woman, treat woman, and educate woman is my only motto of life. And being a doctor, I just also write a book. I'm also author too.
Oh, that's awesome. So what is your book called, Dr. Deeksha?
So this is my book. It's all about pregnancy. And my next book, it's all about periods, will be available soon, within this month only.
That's awesome, guys. If you want to stay updated with whatever Dr. Deeksha is up to and when her books release, please do follow her. We will share her links. So coming to the main topic of discussion, what is menstruation and what does a normal period look like?
Okay, so menstruation is something, this is just like I will explain with the model. So this is your female pelvis, and this is your uterus. So basically, in this, your whole cycle is going on. In this is your endometrial wall, and this is your vagina, from where you shed off your wall. So here we start with the female reproductive cycle. I called it female reproductive cycle because this is not only a menstrual cycle, because in this we are having your four phases. Your first phase start with your first day of menstruation. Then your second phase come with your follicular phase. Then third phase, your basically your ovulation phase, most important one. And the final phase is luteal phase. And this is the four phase cycle. So, start with this, your menstruation, then it down. Then again, you start again with a one, and you will have follicular phase, means your new egg is forming now. Then again, you come to the peak on ovulation day, but again, the new egg is released. Then again, you come to after luteal phase down. If you're so this is basically your embryo is getting implanted. Your body is preparing your womb to get implanted, means your body is preparing for pregnancy. If we don't get pregnant, then the menstruation cycle occurs. So the duration of cycle is basically 28 days. But if the menstruation, in as I say, every woman is different and every cycle is different. So it can be vary from 28 to 45 days. So if you are getting your pregnancy, your menstruation after 40 days or 42 days, it is normal, but it should be regular. It should not be like it come like 40 days, then again it come like in 20 days, and the gap is increasing day by day. So it should be concerned that the gap should be equal. Either it should be 40 days regularly, or it is 28. So menstruation is something, it's a cycle, it's a female reproductive cycle. You start with a zero, ground one, start with a 6 days or 4 days or minimal 3 days. Besides 3 days, if you're having 2 days menstrual cycle, that means you are somewhere in danger. So start with this phase, then again you are in again at zero, because the uterine wall is shed off. Your hormone is like at peak. When you are menstruating, your hormone will fall off. If you are become pregnant, then these hormones will peak too high to your 9 months, to getting your embryo to be implanted, and then your for your baby birth. If you don't get pregnant, then this phase will fall off. So this is your menstruation.
All right. So when does menstruation start? And in today's age, क्या लड़कियों को menstruation बहुत जल्दी हो रहा है? Like we've known, like I've personally seen, like in my cousins and all, they start their periods at 8 years and
Okay.
9 years. Is this very common these days?
Yeah. In some studies I have studied, in many studies, in research data I have seen ki, yeah, earlier the menstruation date in US, as I've seen, it is 12 year. In India, it is a minimal ki 11 year. You are like ready for the pregnancy part. Then in come to Sri Lanka, it's different. In Spain, it's different. So it's very according to climate earlier. But now, as our we got a smartphone, we got luxurious lifestyle. We are full of fast food, and we are like our hormones are like at this, then at this. At morning, I'm full happy. Then at evening, I'm like a depressed one. So this is the our natural cycle. कि जो अभी फीमेल्स हैं वो बेसिकली सुबह बहुत खुश रहेंगी जब उठेंगी एंड शाम तक उनका क्या है उनको भी नहीं पता एक्चुअली. तो इट इज लाइक डिस्ट्रेस वन की अभी मूड स्विंग्स बहुत ज्यादा है क्योंकि आपका जो बेसिकली आपका हार्मोन लेवल बहुत ज्यादा डिस्टर्ब है और उसका रीजन है आपकी लाइफस्टाइल. और इसकी वजह से जैसा स्टडीज पाई गई कि 1970 के बाद से फीमेल्स में ऐसा है जो गर्ल्स है उनका एज जो है पहले था कि 12 टू 17 वॉज योर पेकुलर एज कि इस पे आपको मेंस्ट्रुएशन आएगा. बट नाउ डेज द एज इज कम फ्रॉम 8 टू 15 कि अभी 8 years के बाद लाइक आप यू कैन गॉट मेंस्ट्रुएशन. तो मेंस्ट्रुएशन का बेसिकली ऐसा नहीं है कि मेंस्ट्रुएशन अभी आप बड़े हुए एंड स्टार्ट हो गया. इट विल स्टार्ट विथ 3 phases. Your first phase is basically thelarge in medical, then second is puberty, and third is menarche. And in common term, your thelarge is basically breast budding. Your start up with your breast budding. So you can see, as आप देख सकते हो कि अभी आजकल 7-6 years like they are having a breast, they are starting developing that changes in their body. And second, their puberty means development of pubic hair. This is also earlier. Then comes the menarche, your first phase of menstruation. So due to thelarche and menarche is there, this is basically because of our environment, our pollution, our climate changes, and basically the stress. The 7 years girls is full of stress than us. So this is the reason they are getting much earlier menstruation than us.
Yeah, yeah. And also I
Or
think
earlier the more studies are going on. If it is like we'll update it on our social media, you can just read.
absolutely. And I think also diet भी आजकल का बहुत unhealthy हो गया है like
Yeah,
compared
fast
to
food is the main reason because they are not for crash diet they are not taking the food, or
exactly.
some people are like they are overeating. So overnutrition is also harmful and malnutrition is too. So we need a balanced diet.
Absolutely, absolutely.
Yeah.
My next question is, what can be the cause for a late period या to missed period? What if your periods don't come? So what are the causes for that?
Okay, as you already told now, the diet, first one is the diet. Because we are not going for a supplemental diet, we lack somewhere, we are taking too much calcium, too much magnesium, or too low magnesium, too low calcium. Or we are taking too much of your vitamin E. Like women, I see in my practice, the girls are taking vitamin E supplement without any consultation. They are taking vitamin B complex without any consultation. It doesn't mean if you are having any problem ki you are having same supplemental problem. So diet and supplement is a second condition. Then third come your lifestyle. We don't want to do any work. If we are in a sitting job, like nowadays as due to COVID, the children are not going out. They are just having their online classes at home. So they are like, I just saw in my cousins, they are just lying and just having on laptop. So it is like lack of physical activity is the reason. Then there comes the third part, your obesity. As you become obese, your body is not menstruating properly. You are somewhere fatigued too, and you are full of depression, anxiety. So, and fourth come is the stress. Stress is a major factor because due to which you are not getting enough sleep. And insomnia is there. The 12-year children are dealing with insomnia nowadays. So this is it. Ki, how come they miss their period or late period is there. Then there comes the part they are just going for crash diet, or they are taking antidepressant pill. If you are on any medication, on any pill, that means you are somewhere more prone to late period or prone period, or somewhere you are having PCOD. Sister, the 69 to 70% women in India now dealing with PCOD and they don't know it. Is it PCOD, or either I am feeling low because of fever or anything. And your final part is you miss period because of pregnancy too. So just go and check with your doctor if you are dealing with any problem.
Absolutely. And great that
Yeah.
you even brought up PCOD in the picture, because this month is PCOS awareness month. So
Yeah, this is the PCOD month here.
absolutely. So I think people should be at least well aware of what's happening with their body and go to a doctor if something, if they feel something is wrong.
Yeah, just don't deal with it like just go, don't Google it, just don't
Yeah,
deal with your body because you are having your life. Okay, so don't deal with it like a toy.
absolutely.
Just
I think
come to any go to any specialist. They will help you.
that is the biggest problem, people Googling their own things. You cannot become a doctor or get diagnosed just by Googling. I think that is one big.
Yeah, you know,
And
the thanks to social media, ki doctors are more reachable to us nowadays.
absolutely. So just following your doctors and DMing them or just messaging them is enough to
Yeah,
they'll be able to guide you much better than Google
and
ever.
they will definitely, they will love to.
Absolutely. So my next question is, what are some healthy and good menstrual hygiene practices? Because in India, there are still people who are not following good menstrual hygiene practices. There are still people who don't have access to pads. So what, according to you, are some good menstrual hygiene practices that every woman should follow?
Okay, this is actually a very good question. I just want to talk on it. There are a number of things. Not only the napkin, sanitary napkins is not only the option. You can just go for menstrual cup. You can go for recycle pad. Okay, the cloth pad is also available. You can just go for them, or you can just avoid tampons. Because it is no, it is harmful in many ways than useful. So just avoid the use of tampons. Just go for your menstrual cup is the best part. If you are not able to do it, not able to insert it, then just go for the reusable pad, or you can just go for the reusable pads for menstrual cycle. They are in available in market. And if you're dealing with any sort of like financial economy is not there, then आप normally reusable pad once you reach it and you can use it for 18 months. ओके और आप सबसे बेस्ट पार्ट उसमें है कि आप उसको नॉर्मल एंटीसेप्टिक सॉल्यूशन से यूज करके आप उसको रीयूज कर सकते हो तो उसमें आपको 4 पेज रहते हैं तो आप उसको रेगुलरली आप यूज करो और सेकेंडरी इफ यू आर यूजिंग फॉर नैपकिन्स की अभी अवेलेबल नहीं है इन योर एरिया देन जस्ट गो फॉर कि आप उसको प्रॉपर रीयूज करने के बाद रीयूज ना करें सॉरी उसको डिस्पोज करें उसको 4 to 5 आवर में आपको चेंज करना ही है और आई नो इट इज सो कॉस्टली कि आप कुछ भी ले रहे हो और आप उसको डिस्पोज करने के लिए ले रहे हो तो जस्ट गो फॉर menstrual cup. My suggestion is just go for menstrual cup. And second suggestion is about your vagina. This part, this is your just basically your vagina. So just vaginal wash is there. But I know that the females are using nowadays a perfume, soap, and gels are there. They are using it without any consultation, so just don't use them because your vagina is a self-cleansing organ. It can cleanse themselves only. So just you can go for normal mild water you can use for the to maintaining the pH. You can just go from anterior to posterior, आगे से पीछे की तरफ ले जाए बट पीछे से आगे की तरफ आपको नहीं लाना है ये आपको याद रखना है because this is from front to back you have to go, not from back to front whenever you are using water, whatever, if you are menstruating or not, but don't go from back to front. So आपको आपके वेजाइना टू एनस तक जाना है बट एनस टू वेजाइना कभी भी नहीं रिटर्न होना है एंड उसके अलावा आप सेल्फ क्लींजिंग है वो खुद ही साफ कर लेगा आपको उसमें मेहनत नहीं करनी है आपका जो थर्ड मोस्ट इंपॉर्टेंट पार्ट है परफ्यूम्स जितना ज्यादा हो सके कम यूज करें डोंट गो फॉर परफ्यूम्स if you are using it then just go for a cloth perfume कि आपने cloth पे use करें don't go directly with your body because these perfumes can cause a number of hormonal changes are there as a woman you already dealing with hormonal changes your hormones are sometimes rising suppressing and sometimes stable so just don't disturb them more so avoid perfume as much as possible हाँ बहुत जरूरी है then go for it कि अभी करना ही है then go for कि करना ही है then तो कुछ कर ही नहीं सकते but as much as possible just stay away from the perfume things either it is soap or your deodorant whatever it is or you wanna do now then just go on your clothes don't go on your body direct and especially your undergarments just change your undergarments as much as possible within 4 months not more than 4 months or maximum to 6 months because undergarment is something which is directly dealing with your body like your oils is there ठीक है, your order is there, your sweating is there, so don't go for it directly. And third part is like, shaving. I just in my practice I used to deal with ki, the girls are nowadays shaving their pubic hair are there and their armpit hairs, so just shave them. Shaving is something, hormonal imbalance is again there. So if you wanna go for just, some clinics are there. They are going for vaginal wash and vaginal cleaning is there. You can just contact there. Just don't go for home cleaning and all, because I know ki this is something ki nowadays girls are like, they just want to be look beautiful, charming, but it is something which is disbalancing your hormone. So just avoid it completely.
There were some great points over there, especially the direction of washing always from the vagina towards the anus and not towards the anus to vagina. That's something
Yeah.
that's extremely important. And I like that you even touched base on changing the underwear once 3 to 4 months, because people, don't do that, don't even think about it. And
And
really,
the bra part is most important because nowadays girls are getting period at the early age, so the chances of getting their breast cancer is more. So just go for proper bra. If you're not getting proper bra, आपको नहीं आता है लेना, just take to help of your mother. बहुत सारे चैनल्स है जो हेल्प करते हैं कि आप कैसे ब्रा खरीद सकते हो. इफ अगर तब भी नहीं आता है, just go for sports bra. आप कुछ भी मत लो फिर उस केस में, क्योंकि क्या है, आप कहीं ना कहीं खुद को डैमेज कर रहे हो. ठीक है. बट ब्रा पे आपको बहुत ध्यान देना, कंसंट्रेट. एंड अंडर गारमेंट्स बहुत लूज नहीं होना चाहिए, बहुत टाइट भी नहीं होना चाहिए. ठीक है. एंड टिल एज ऑफ 21 जस्ट अवॉइड पुशअप ब्रा. ठीक है, वो नहीं लेना है. उसके बाद आप यूज करो बिकॉज यू आर समवेयर यू कैन डील विद इट. बट टिल 21 आई थिंक यू आर नॉट मैच्योर एनफ टू डील विद इट.
absolutely. I mean, those were also some great points. And I also like that you touched base on sustainable period ki menstrual cups use करें और reusable cloth pads available है उसे use करें. So doctor, menstrual cups, do you have some good recommendations of brands available in India? क्योंकि मैंने देखा है कि I have personally tried and कुछ बहुत soft है, कुछ थोड़े और hard हैं. तो किस
You can
तरह?
just, P and Safe is great. I
Okay.
myself use for P and Safe, and this is great. Yeah, either it's menstrual cup or pad. If you are just, the best part of menstrual cup is this key. You can just go for swimming. You can
Yeah.
just go for the part. You don't have to look shy. You don't have to be in corner because you are menstruating. You can just do whatever you wanna do. But the thing with menstrual cup is you should learn how to insert it,
Yeah.
because your body is like in this way, your body is aligned, so you have to just put it in this way only.
Yeah.
You don't have to just leave it on straight because you are going to hurt your soft muscles or tissues. So if you don't know it, just go for reusable pads are there or pens are there, you can just use them. Or either you can just go to any doctor or specialist, you can just learn, they will teach you how to insert it.
Absolutely. Inserting the right way is important because there can be chances of leaks. Yeah, you've not put it properly and all of that.
Yeah, you can just hurt your vagina, which is very soft part,
Absolutely, absolutely. So my next question is about PMS. So what exactly is PMS and when does it occur? I know a lot of women go through it, but we would like, your guidance on telling us that what exactly is a PMS and why does it occur?
Okay, PMS, I will talk on both terms, on medical and in layman language. So on medical term, PMS is something, no, premenstrual syndrome is the full form. And premenstrual syndrome means, as the name suggests, premenstrual, मतलब menstruation के पहले आपको कुछ जो symptoms आएंगे, और वो symptoms आपको a week, 2 days, 1 day before आ सकता है. और अब कुछ लोग ऐसा बोलते हैं, ऐसा स्टडी में पाया गया कि 20 days before भी PMS आपको फील होता है. और उसमें जो आपके सिम्टम्स बेसिक रहेंगे वो रहेगा आपका डिप्रेशन, एंग्जाइटी, मूड स्विंग, स्लीप डिसऑर्डर, basically insomnia is there, and the chances of like the woman is vomiting, diarrhea chances is more there. Chances of if you are having any allergy like skin allergy is there, you will feel more allergy when on PMS. And chances of infection, in some cases we have seen eye infection is also there in related to PMS. The lady complains ki I'm just irritation is there, so and it will subside as she gone through her menstruation. So PMS is something you are having problem, but it will subside as your menstruation start. So these are the problem started with your luteal phase and just end up with your menstrual phase. So PMS in medical term, what we call ki, there's a hormone called serotonin. which will regulate your mood, your sleep. So, serotonin is a good hormone for body. If you are like not having enough, your halfway ovulation is there. Your not full ovulation is not there. You're ovulating before or after. That means your hormone aldosterone and androsterone and progesterone will fall off. That means these falling will cause low level of serotonin is there. Due to this there is low level of your sleep, your insomnia, means your PMS is there because of serotonin. So if you go for physical activity, the feel good hormone endorphin is more there. So if endorphin is more there, that means you will feel more good. So my suggestion is just lifestyle is the only key. Just work on your lifestyle. Start doing exercise right now. If you don't go for any exercise, you don't get time, just start walking. Walking is the ultimate exercise. So whenever if you're like having a week before, then start with a week before with the exercise. You can just go for walk, you can go for treadmill, you can go for cycling, you can go for normal Surya Namaskar salutation is also good. Your body should move. You should leave your chair and just move. So this is the only ultimate solution to your PMS.
Absolutely. I think the answer to that is move your bodies and you will feel better. So my next question is, what are some of the disorders related to menstruation? Because आजकल इसमें भी बहुत देख रहे हैं कि किसी के periods normal ही नहीं है, कुछ ना कुछ problems हैं. तो what are the common ones?
After COVID, there's more.
Yeah.
Okay, so first we'll start with amenorrhea. In normal term, we call it your missed period from a longer duration. This can be primary and secondary. In primary, you are basically missing your period, but basically you don't have period at all. Means कि आपको कभी periods हुआ ही नहीं है. Then it's primary amenorrhea. In secondary amenorrhea, आपके घर में कोई शादी है, कुछ ऐसा फंक्शन है और ड्यू टू एग्जाम आपको स्ट्रेस की वजह से, आप बहुत खुशी की वजह से आपको पीरियड्स ही नहीं हो रहे, आप बहुत दिन से सोए नहीं है क्योंकि, ठीक है, ये आपका आपका सेकेंडरी अमेनोरिया में आ जाएगा. तो प्राइमरी अमेनोरिया मीन्स समथिंग, आपको टर्नर सिंड्रोम है या आपको क्लॉडी सिंड्रोम है, बेसिकली किसी सिंड्रोम की वजह से आपको यूट्रस है ही नहीं. तो इस केस में वो फीमेल को, या आप यूनक है, बेसिकली इस केस में आपको कभी मेंस्ट्रुएशन हुआ ही नहीं है, तो आप प्राइमरी अमेनोरिया को. सेकेंडरी मीन्स आपको एक फेज तक मेंस्ट्रुएशन हुआ है, बट अभी ड्यू टू योर ऑफिस, योर स्कूल, योर पर्सनल प्रॉब्लम, यू आर नॉट गेटिंग योर मेंस्ट्रुएशन. दैट मीन यू आर डीलिंग विद द सेकेंडरी अमेनोरिया. और वो आपको पिल्स की वजह से हो सकता है, किसी तरह के फीवर की वजह से हो सकता है, न्यूट्रिशन, लाइफस्टाइल, कुछ भी रीजन हो सकता है. Then you are having secondary. Then come to second your first is your amenorrhea, second is your dysamenorrhea. Dysamenorrhea आपने देखा होगा, कुछ ऐसे गर्ल्स होती हैं, वो बोलती हैं कि जब मुझको पीरियड्स आता है तो इतना भयानक पेन होता है कि मैं मूव भी नहीं कर सकती, आई कांट इवन मूव डाउन टिल 3 days. तो इसको dysamenorrhea बोलेंगे. आप फीलिंग लाइक क्रैम्प और क्रैम्प लाइक पेन, उनके पेट में पूरा ऐसा, वो बोलते हैं कि ऐसा मरोड़ उठता है एंड वो बिल्कुल भी मूव नहीं कर सकते. और कई बार को कुछ वीमेन तो बेहोश भी हो जाती है कि वो, या डिहाइड्रेशन भी होता है, एक रीजन ये भी है. तो ये दिस इज योर डिसएमेनोरिया. दिस इज ऑल्सो प्राइमरी एंड सेकेंडरी. प्राइमरी मीन्स की आपको हमेशा से प्रॉब्लम है, सेकेंडरी आपको अभी नया नया आपको स्ट्रेस की वजह से डेवलप हो रहा है. देन कम योर पीएमएस. एज वी ऑलरेडी डिस्कस, पीएमएस इज समथिंग रिलेटेड टू योर हॉर्मोन्स. Either it is too high or too low. Then it is a premenstrual syndrome. Then fourth is your leukorrhea. Leukorrhea is your, sometimes you see the girls complain of white discharge or yellowish discharge. But before or after menstruation, not during menstruation, in between menstruation, somewhat they are having your yellow discharges there, which will, that fall order is there. So it is like you have to see your doctor if you are feeling so. If you are having normal white discharge, that means you don't have to deal with it. But if you're having any kind of like yellowish discharges there, you have to just seek your doctor soon. Then there comes the menorrhagia. Menorrhagia is basically your heavy bleeding. Some women complain of, or the causes can be endometriosis, means your vagina, your like menstruation is like falling off. The lady have to change 4 to 6 pads or more than this in a day, in a cycle. So that means you are dealing with menorrhagia somewhere. Then there come the menometrorrhagia. Menometrorrhagia is something you are bleeding outside your uterus. The ladies complaining of bloating, the lady is complaining that there is something like she is bleeding, like more pain is there, I can't just deal with it, I have to die. So this is menometrorrhagia. Means you are spotting between your vagina, you are just spotting, and no menstruation is there, only spotting, and then there comes a normal phase. So this is your menometrorrhea, and these all are like your amenorrhea, dysamenorrhea, your PMS, your licorrhea, menometrorrhea, and metrorrhea. These are like you have to go and see your doctor, your gynec, soon as much as possible.
Absolutely. But in layman's term, what are these common symptoms? जैसे आपने बोला like spotting and what
Hmm.
other things like if you can name five, six at least that girls and women should keep in mind कि अगर मेरे को ये symptoms हो रहे हैं मेरे को definitely डॉक्टर के पास जाना है periods के time.
Okay, okay. When it comes to menstruation, सबसे पहले if your cycle is more than 7 days, आपको 7 दिन से ज्यादा अगर मेंस्ट्रुएशन हो रहा है, जस्ट सी योर डॉक्टर इमीडिएटली. अगर 2 दिन से कम हो रहा है या 2 दिन तक हो रहा है और ऐसा लगातार 3 to 4 साइकिल में आपने नोट किया है, जस्ट सिंपली गो विथ योर डॉक्टर. देन देयर कम्स द येलोइश पार्ट कि मैंने बोला कि वेजाइनल डिस्चार्ज एक येलो हो रहा है, नॉर्मल वाइट ना हो के अगर येलोइश है या डार्क ग्रीन है या लाइट ग्रीन भी है, देन जस्ट गो फॉर योर डॉक्टर. देन ब्लोटिंग पार्ट कि आपको पेट में एक मरोड़ उठ रही है और वो जनरली जो मरोड़ है आपको ब्लोटिंग यहाँ पे हो रही है, इसके जस्ट आपकी एक नॉर्मल बोन होगी उसके जस्ट ऊपर, 2 फिंगर ऊपर. आपको पेट पे जो आपका अम्बलाइकस रहेगा, मीन्स हिंदी में नाभि बोलते हैं शायद, नाभि के जस्ट नीचे आपको अगर प्रॉब्लम है, दैट मीन कहीं ना कहीं जस्ट सीक विथ योर गायनिक कि व्हाई आई एम हैविंग दिस ब्लोटिंग. Yeah, yeah. I think you just missed some part. I
Yeah,
think
yeah,
some
yeah. I
network
think
problem with you.
yeah, yeah. No problem. My Wi-Fi got disconnected. So yeah, I think
Okay.
we were
So are
talking
you
about
in?
commoners
So
of
yeah, yeah. I can hear you. Just tell me.
the best ways of managing period cramps and pain during menstruation.
Okay. Just start with the rest. First, if you don't know anything, just go for the rest. And second, keep your leg elevated. Means when you're lying ना, आप जब लेटे हो पैर को उठा के रखो. Either you can use a stool or you can just use 4 to 5 pillows. And just start with normal. Start with your hand with your this part, your abdomen part, and just start with normal breathe in through nose, and your abdomen will come out and breathe out through mouth. So start with your abdominal movement, normal when you are lying. And second, just go for your abdominal massage. What you have to do, just like this is your abdomen, just go with your like you have to just stretch out and just move your abdomen. Means around your umbilicus, you have to just massage your abdomen, or you can just go for heating pad normal, or you can just my best trick is just go for castor oil pack. Just use the normal, you can get whatever castor oil is there, you can go for any brand. Just heat it up, and just with the help of cloth pad, you can just wrap around your abdomen, and just wrap the soft cotton cloth. And when you know the castor oil pack just work like a miracle. You can just go for contrast bath. Contrast bath, in general, you can just go for 2 टब. एक में आप ठंडा पानी लो, एक में गर्म लो. तो in 3 minutes आप इस ठंडे पानी में बैठो, then 3 minutes आप इस गर्म पानी में. Then just start reducing the time. Or till 15 minutes you have to continue the same. So contrast bath work the best when it is menstruation pain or cramp is there. Or you can just go for take the warm beverages. आप कुछ गर्म पिए, ठीक है, but don't go for caffeine. You can just take the hot water, soup is there. And the best part, just go for some like you can just go for, I said the exercise. Just a week before you can start with the exercise. And then the girls to ask me ki, what sort of exercise we can go. So exercise just like as I say, just start with some movement. It is even the walk is the best, because from nothing, if something is there na, this is best. Just, if you don't know anything, just go for the exercise. And if you seek more exercise, you can just find it on my channel. My YouTube channel is there. I just put some exercise on menstruation, your cramp, your PCOD exercise are also there. You can just go and find there with the name Dr. Deeksha Singh Hormonal Living.
Absolutely. Guys, do check out her YouTube page, and I'm sure you will benefit from watching her videos, especially related to, menstruation and to prevent your cramps. I think somebody asked how to make castor oil pack and what is the benefit. The benefit is for menstrual cramps, and yeah, I think Dr. Deeksha has already explained how to make it. You can just look at the video once we save this on ITTV. She has another question: how to reduce belly fat after C-section? Do you have any tips for that?
Okay. Definitely, I'm having. Just go for start with, if you're having C-section, just start with your that incision mark is there. Just start with your that incision massage. Okay, you have to just lift that incision, just move it. Okay, you do it regularly, and start with when you are done with 42 days of rest. Just start with normal. Avoid crunches. You don't have to go for this movement. Beside this movement, you can start with walk. You can go for abdominal breathing. You can just go for with abdominal breathing, and you can go for your breathing. It means you have to just aside your pelvis part up and down. And for further, as I have said, just go for my channel. I already put some exercise on there. You can just find the video, which is more useful because it is not possible to show everything on this part. As you can just find every exercise video on my page. And if you find more difficulty, you can just go for this book. This book contains everything. And if
Absolutely.
you just want to get you're not fertile, the infertility part is also covered,
Wow, that's awesome. That's
because
awesome.
it's all about pregnancy.
Right. From like pre-pregnancy to I think post and reducing the
Yeah, your breastfeeding part is also covered. What you have to eat, what you don't have to avoid.
it will be really helpful, especially for first-time mothers and people who are very
Yeah.
anxious about it. So, guys, do check out her book. We have another question. Somebody say, "Hey Deeksha, do throw few pointers on usage of period pills and contraceptives that are affecting the menstrual cycle."
Okay. If you are asking for period pills, so I must say there's no pill made for periods. people are taking it, ठीक है, girls are taking it, as I say, on Google Doctor, ठीक है, they are just spreading their this like कि एक ने एक से कहा, एक ने दूसरे से कहा, you can जब मुझको था तो मैंने ये लिया, then you can just go for it. So simply don't go for any pill. If you are having any problem, just go with a specialist consultation. They will help you. If we need any any hormone are there, we'll deal with your hormone directly. Why to just compel your body for that? And second, your contraceptive, it is not necessary ki, men are using contraceptive, but women are also having one. Like vaginal condom are also there. You can just go for it. And simply, if you want, you can just go for, if you are having child, already having child, just go for a temporary, temporary contraceptions are there through surgical part. This is best for you, will work for you. And copper tea, I don't recommend it because, in some cases, it is not beneficial. But just go for a condom part is the best one if you know how to use it.
Absolutely, absolutely. Because I know a lot of people are simply popping pills without even any doctor's consultation or recommendation, which is not good for you guys. Okay, guys, if you have any more questions, please do put them here. Shweta is saying hi, Shweta. All right. My final question is, do you have any message for all the women out there? And where can people, get in touch with you for a consultation? Yeah, please do tell us your YouTube handle, your Instagram handle, and where people can get in touch.
Okay, I will tell my message in the last. I'll just start with, as I already told about this book, it's all about pregnancy. And my second book, the women's, it is launching soon. Before 22 September, it is launching on Kindle. We are launching it first on Kindle, and its name is It's All About Periods by Dr. Deeksha Singh. And the best part about the book is कि वो सिर्फ 99 रुपए का होगा, और 99 रुपीज ओनली, बिकॉज अभी जो मेन वो बुक का जो पर्पस है वो है कि हर जितनी भी लड़की है उसको खरीद सके, जितने भी द गर्ल्स अमंग अस शुड परचेस इट, एंड विदाउट एनी इकोनॉमिक इशू, कि अभी लेना है तो लेना है, बिकॉज द बुक कवर, इट्स ऑल अबाउट पीरियड, कवर योर disorder part, your lifestyle part. It also having your complementary diet plan for all the phases you are dealing with, and all having treatment tips. The basic tip, if you're not you are living in an area where you can't go with a doctor, your family is not open up about the gynec at your teenage, just search for my book, and even my contact are also there. You can just find me on www.hormonalwings.com, my website. Okay? Or you can just find me on my YouTube, Dr. Deeksha Singh Hormonal Wing, and my 3 IGs are there. First, Dr. Deeksha Singh Hormonal Wing. Second, period pelvic floor rehab specialist, Dr. Deeksha Singh, and third is period encyclopedia, Dr. Deeksha Singh. You can find me on these three on my website, Hormonal Wing, or you can just find me, or you can just normal go for Amazon and just write the book name. It's All About Pregnancy by Dr. Deeksha Singh. You can find my book there, and all my details are already in the book. Or It's All About Period, that this is the book, my dream book. It is launching soon, and it is my gift to every woman, every girl, and their child. Because as a woman, as when I was a teenager, I just seek for such book which is come under 100 rupees, so that I can purchase it. I can just have it in my pocket whenever my child or me is having some issues. Like I am having leukorrhea, I am having dysmenorrhea, amenorrhea. You don't have to see for any doctor directly. Just go for this book. If you are beyond this problem, just come to us simply. You don't have to bother us for a normal problem, because like leukorrhea, amenorrhea problem, you are missing period, then the treatment is also inside the book. You can just find it, because the name suggests it's all about periods, and it is under 99 rupees only.
Absolutely.
So this is the first thing I want to say. And second, you can find me on www.hormonalwings.com. And my message to all women. So I'll start with the teenager girl. Okay, just don't go for any crash diet. Avoid crash diet. You are beautiful, whatever the shape and size you are. Second, here comes the 25 age. You are already beautiful. You are already gorgeous. Just go for your studies. Go for your career. Build up your career. Don't be dependent on anyone. So that one you can say, I'm not dependent on anyone. I'm dependent on myself. I'm a self-made person. Third thing, when you're 30, just start preparing for your the pregnancy part. Start seeking for a motherhood, because this is the phase you can just take a leap from your career. Take a leave for at least for 2 to 3 years when you are having a child, because the motherhood time is more important. You're going to miss it if you're going to just ignore it. So just go for motherhood after 30, or you can just before 30 you can plan to. And then after 30, 35, just go for your career. Seek for your career to your top high, because you already have a child, you are already having a family. Just go for your career now. Then you are 40, just start seeking for your physical activity. Start seeking for, you have to look sexy, you have to look cute, you have to look beautiful at this age, because your hormones are already going to subside after 10 years. Then come the 50, you're already through menopause. Just start dealing with it. Start seeing some specialist doctor to deal how to deal with that menopause part. Then comes the 60. You now you are having time. You are already on your career half. ठीक है कि आपने अपना career बना लिया. You are having family. Just go for some supplement. Go for some friends, some outing. अभी इस टाइम पे just go. This is your self time. So start dealing with your giving your knowledge to your elder one. Then comes the part of 80. At the 80, you have to write more and more books. I'm not saying you are a doctor. Whatever you are, just write a book, write a note at least a day, because you don't know how much is going inside your mind. So when you are starting writing, the stress is already subside. And my common message to all age group: cut caffeine. Don't take caffeine. Don't take stress. Sleep 8 hours per day. Read as much as possible. Study more. And if you're not good in study, just go for some skills, because every woman or man are born with skill. Just go for some skill. Okay. And as I said, if I am a doctor, just seek for some doctor. Just don't be a Google doctor. If you're a teacher, I will come to you for my child. If I am a doctor, just come to me for your body. Okay. So this is my message. And as I already say, being woman, love woman, treat woman, educate woman is my only motto of life.
Absolutely. I think that was some of the best advice we've ever gotten. You've covered the entire lifespan of a woman, and I can't tell you how inspirational you are. Not just because you're a doctor, you're writing books, and that too books that can be accessible to all. And thank
I'm writing book during COVID. I started writing my book because one day I don't know when I'm going to die. I don't know. But before dying, I just wanna gift many things to women as much as possible, because I can't reach every woman, but my book can reach. My book, my consultation fees is so high, but you can buy my book at a low nominal price, because it is under my will. But I can't just change the consultation and time, because the time is important. I can't change the time. I can't give my all time to every woman. But yes, I can write a book. I can write an article. You can just read them, and you can just as much as possible. I wanna write. I wanna help women as much as possible, because मैं यहाँ तक पहुंची बिकॉज बहुत सारे विमेंस मेरे पीछे हैं. तो मैं चाहती हूँ बहुत सारे विमेंस मेरे आगे पहुंचे ताकि मैं पीछे खड़ी हो सकूं. And
absolutely.
being a woman, just trying to help other women. Don't try to step them down. उनको हाथ पकड़ के ऊपर लाना है और नीचे नहीं छोड़ना है.
Absolutely. I mean, only if women support women can the society
Yeah.
progress. A beautiful end to this live session. Guys, we're going to be saving this on IGTV, and we will also share this on our website, girls.buzz. And you can find all the links to Dr. Disha's website as well as her YouTube and Instagram over there, and you can get in touch with her. Dr. Deeksha, thank you so much for being so inspirational and taking out your time in doing this
And
live
thank you
session.
so much for inviting me. And even, I just said yes to you because I just like the name, Girls for India. This name is the reason ki you just asked me once for that video. I just said once yes without any hesitation. I don't know anything about that time, about the Girls Watch, but the name is something. This is like my website name is Hormonal Wing. This is something you can just have in your mind ki this is something related to women. So Girls First India is something related to women. So I just I have to go for it. I have to just seek some time.
Thank you so much. Thank you so much. I'm sure our entire team will be happy that you like our name and you could, connect with us.
Actually, I
So
just love your name. I'm just going to just stole it once.
All right. Thank you, Dr. Diksha, for joining with us, and also thank you all the audience who's come, and taken out their time for this live session. And we will see you again soon. Thank you so much. Bye bye.
Thank you. Bye bye.